Malhotra is joining us from Europe today. As I said, he's an NHS-trained cardiologist. Dr. Malhotra, you started off by being an advocate of the vaccine. You were actually trying to address what was then known as vaccine hesitancy. You went on social media platforms and you actually batted for the vaccine, as it were. This is one of your old tweets from 2020, which said vaccines are the safest of all drugs. Then you had a personal tragedy in your family. You lost your father, very much like my father, who I also lost to COVID. I read about an ambulance delay. Something similar happened with me. The oxygen cylinder in the ambulance that carried my dad to hospital didn't actually work. I thought my father died because he didn't get two vaccines. You think your father died possibly because he had an mRNA vaccine. Like, we have two completely different responses. Why did you think that, Dr. Malhotra? How and why did you go from being a vaccine advocate like all other people at the front line to somebody who believed that you lost your father due to the mRNA product? He died, of course, from a cardiac arrest. Dr. Malhotra.
Thank you, Baraka. Yes, so just to walk you through that, first and foremost, I must reinforce what you've already said, and I still believe this to be the case, that traditional vaccines are, when you look at all of the drugs that we prescribe, as a pharmacological intervention, one of the safest. And certainly, data suggests globally, and this is particularly important in countries like India and other developing countries, vaccines do save lives, traditional vaccines. But those vaccines go normally through very rigorous safety testing over a number of years. I myself, I was born in Delhi. Both my parents are graduates of Indian medical colleges. I still have many scars on my left arm from BCG, even smallpox. I have the smallpox vaccine. So I'm very much a supporter of traditional vaccines. That has not changed. But what happened with me is, and with that, keeping that in mind, when we originally started rolling out the vaccines in the UK, I could not in any way, shape or form think that a vaccine, which are the holy grail in medicine, could cause any significant harm, and certainly not harm to the heart. And in fact, I have many friends, I've worked in health policy roles, people who are well known in India, for example, the film director Grinda Chadha, Shekhar Kapoor, I just spoke to shortly before this interview. I'm going to tell you what I told him and what he's doing in a minute. And these people took the vaccine under my encouragement. Okay, so let's make that very clear. So that was January, and in February 2021, Good Morning Britain, which is one of the most watched TV programs in the UK, asked me to go on the show to help tackle vaccine hesitancy amongst ethnic minority communities. Certainly abroad, ethnic minority communities, people from the Black community, Indian groups, for example, tend to be more vaccine hesitant because of less trust in government. So I went on to reassure people. And then things evolved over time. So the first thing, of course, is my dad, who was a very well-known doctor in the UK, general practitioner. He was a vice president of the British Medical Association, first non-white person to reach that role. So, very well-known doctor. He also very much was supportive of the vaccine rollout. He had 2 doses of Pfizer. And he suffered a sudden cardiac death, which was unexplained at the time. I knew his cardiac history inside out. He was one of the healthiest people of his age at 73. And his post-mortem findings did not make sense to me. He had 2 critical stenosis in his arteries, essentially 2 severe blockages that had rapidly progressed because we had done some scans on him a few years earlier. So that didn't make any sense to me. And of course, my area of research is actually changing the understanding of how heart disease develops and how we can potentially reverse it. I've published in medical journals extensively on this. My colleague earlier talked about publishing in JAMA. We published, with 2, the editor of JAMA Internal Medicine is a cardiologist, and another cardiologist. We published an editorial a few years ago explaining that heart disease is an inflammatory condition. So things then evolved, and then several bits of data started to come to me, which were very disturbing. The first one was an abstract published in Circulation, which essentially suggested, Baraka, that the mRNA vaccines, and we're talking about mRNA vaccines specifically now, but I'm going to come on to Covishield in a minute, is it increases inflammatory markers in the blood that are linked to cardiovascular risk, okay? Essentially accelerating heart disease and accelerating heart attacks. But it was just one bit of data. Since then, many bits of data have emerged that show clear causal evidence that the mRNA vaccines, Pfizer and Moderna, are linked to serious adverse events, the most common of which are clotting abnormalities, heart attacks, strokes, pulmonary embolism. That is irrefutable. So there is no doubt whatsoever that the COVID vaccines are increasing the risk of heart attacks. Now, whether COVID does that is very debatable. Certainly we know with severe COVID at the beginning, of course, any inflammatory condition on the body, any stress on the body, pneumonias, for example, are going to exacerbate cardiovascular problems. But we now have very good data showing mild COVID does not do that. In fact, interestingly, a publication only a few weeks ago in BMJ Heart revealed that mild COVID was associated with less risk of a heart attack.
So
There's a lot of conflicting.
Can I jump in? Can I jump in with two
Sure.
points, and then before you tell us about your argument on all the vaccines together, I want to give the panel a chance to respond to what you said. But some points for you. The British Heart Foundation, in response to your argument, said that there is no evidence to link increased cardiac risk to the vaccines. I'm just quoting here verbatim. Secondly, we have now reasonable data from all across the world, including in India, to show, I'm not a doctor, I can't tell you what other impacts the vaccines have, but that the vaccines appear to have worked for the one purpose that they were meant for, which is to contain hospitalizations and mortality. And if we bring up these slides, you will see an Indian Council for Medical Research study in 2021 found that hospitalizations were down to 9.8% and 0.4% mortality after 2 doses. So I take you back to my dad, Aseem. I kept thinking, gosh, if he'd got the second dose in time, maybe he would have lived. This is another paper from Yale University and the University of Maryland that has argued that vaccines prevented 18.5 million additional hospitalizations and 3.2 additional million deaths. And without the vaccines, there would have been 120 million additional COVID infections. Now, quickly, because I want to give the others a chance to respond, and we'll come back to you. Do you acknowledge that the vaccines have helped in preventing, containing hospitalizations and mortalities? Yes, they obviously did not take the time to be tested in the way that a normal vaccine would, but it was a global crisis. That time wasn't available.
So the answer to your question, Baraka, is first and foremost, when we look at this data, they're called non-randomized studies, right? And I will quote the Stephen Hawking of medicine, Professor John Ioannidis, the most cited medical researcher in the world, independent, has great scientific integrity. And he said these findings from non-randomized studies may be spurious, in other words, fake. Now, that doesn't mean that they haven't helped and reduced COVID mortality and hospitalization. I'm not saying that. In fact, my own peer-reviewed research independently, published in a journal, by the way, that doesn't take money from pharma. Just to go back to Dr. Balbir Singh, I'm not contradicting what he said, but people need to understand many of these medical journals, most of the ones you've cited, are heavily conflicted. They get hundreds of thousands, if not millions, from the drug companies. And that's really important because we need clear, independent data here. Now, just very quickly, Baraka, to answer the question, to break it down in terms of your father, I'm very sorry you lost your father. And by the way, you know, the editor of the journal that I published in, we had a conversation first, also lost her own, one of her own parents to COVID. So we're not denying that COVID at the beginning was very, very devastating. I know friends and family and people in India, for example, that died. We're not denying that. The question is, what benefit does a vaccine add? Now, we analyzed this in the UK, and I looked at Delta variant, and we broke it down by age. And this is really important because without understanding the numbers involved, the public and doctors are vulnerable to exploitation of their hopes and anxieties by vested interests. And I mean big pharma here. Okay. Now, let me just break it down. It's very important, Baraka. So if you're over 80 on the Delta variant, at best, the COVID vaccine reduces your risk of hospitalization or death from COVID by 1 in 230. 520 if you're 70 to 80. We're then talking about thousands. Now, what's the risk of serious adverse events? That's important. Because if there are no adverse events, Baraka, put it in the water supply. Put it in the water supply. You'll save many, many lives. The adverse events we are seeing are unprecedented. And with AstraZeneca in this country, which is Covishield in India, we actually stopped using it because the amount of adverse effects were unprecedented. We stopped using it, effectively suspended it. And you've carried on using it in India, which is horrific. And by the way, Prime Minister Modi, I must just say this, he must call for a complete suspension of all COVID vaccines pending an independent panel of scientists. And please liaise with people in the UK like Carl Hennigan, the director of evidence-based medicine.
Okay, I need to jump in now.
Because this is horrific. This is horrific, and it needs to stop.